Hi, I'm Dani Gasparini, and welcome to this segment of Penn Voice. I am joined today by Janet Wagner, who is the CEO of Mills-Peninsula Medical Center, and also Dr. Ilana Spokoyny, who is the stroke neurologist and clinical research director for Mills-Peninsula Medical Center. So we have something really important to talk about today, and that is stroke. We know Mills-Peninsula Hospital is renowned for so many service lines and so many great things, but today you wanted to come on and talk about something that is unique, that's happening probably for the first time even across the United States. So Janet, why don't you kick off and tell us a little bit about the stroke mobile unit?
I'd be glad to, and thank you for having us today. You bet. The mobile stroke unit is really groundbreaking care. It's pre-hospital care. So a lot of times we talk about when a patient comes to the hospital. This is what happens before a patient gets to the hospital. So we're very excited about this state-of-the-art care that we'll be delivering in our community with the mobile stroke unit.
And Dr. Spokoyny, with stroke, timing is of the essence, right? So we want to talk a little bit about some of those symptoms, some of those things to look at. But then, as you talked about, Janet, the delivery of care then starts happening the minute the individual has recognized that they may have symptoms. So tell us a little bit about what those symptoms are and then what happens next.
Absolutely. So stroke is the sudden onset of neurologic symptoms, and those can look different from person to person. But in order to highlight the importance of calling 911, like you said, activating those emergency services early, we have an acronym that we use to have people remember and help them identify if some of their symptoms could be stroke symptoms. So that acronym is B FAST. So the B stands for balance. So people might feel imbalance or trouble walking. The E stands for eyes, so vision, loss of vision or double vision. And then the F stands for face, so facial droop on one side typically. And the A stands for arm, but it can be arm or leg, numbness or weakness. And the S stands for speech, so trouble getting the words out or slurring of the speech. And the T, again, is just to reemphasize that time is really of the essence, like you mentioned. So time to call 911 and activate those emergency services.
And in Be Fast, is it symptoms that I would recognize within myself, or is it typically someone might recognize it of me? Do I know these things are happening?
Great question. So sometimes you would notice it in yourself, and other times somebody would notice it around you. Facial droop is a good example because sometimes you won't notice necessarily that your face is drooping unless you happen to walk by a mirror and see it. You may think your mouth feels funny or something like that. Weakness, on the other hand, people will typically pick up in themselves. But the reason we educate the community as a whole and not just stroke patients about stroke symptoms is that it's so important to be aware of them, not just for yourself, but for those around you.
And one last question on Be Fast. Are they symptoms that all happen and need to happen together, or could it be one symptom independently?
Excellent question. It can be any combination. It can be one symptom independently. It can be several of them. It can be all of them.
Okay. So going back to timing, Janet, we need to call 911 when we see these symptoms happening or feel these symptoms happening. What is different now with the onset of this mobile unit?
Well, with the mobile stroke unit, we're proud to say that we're partnering with AMR, American Medical Response, which is our local ambulance service. Right. And I also have to add all of the EMTs and the county who have been supporting this project from the beginning. And what's different is this. When the 911 call comes in, if we think it's a stroke, the stroke mobile will be deployed along with a regular ambulance. And that's important because with stroke, timing is critical. Every minute, every second counts. In fact, we know that we can save 2 million brain cells a minute if we can get treatment to that patient. So the stroke unit has a team of specialists on board who can assess the patient, treat the patient, and start that treatment right away so that we're preventing further complications from occurring. So that would give the patient a better chance for better outcomes and a better rehabilitation path.
So it's interesting because if we looked back decades ago, we used to deploy a fire truck when 911 was called. Then we started bringing on EMTs to our fire truck. along with a separate ambulance service. So now we're even going a bit further, and we're saying we're get even more specialized in understanding care.
So let me tell you one piece I forgot to tell you that's really important. Aside from the specialists that will be on this mobile stroke unit, like our physician here, Dr. Spokoyny, who could be right there to treat the patient, we also have a CT scanner. So from the outside, the ambulance will look exactly the same. On the inside, in addition to the team, there will be a CT scanner, and you need a CT scanner to determine what type of stroke are you treating.
So from the moment 911 is called, it goes to a county dispatch. At that point in time, county dispatch has been trained to know whether or not to deploy the mobile stroke unit. And once it is, there is already someone that is on that unit and going to the patient. And then that patient is being treated and transported to the hospital, already administering and already knowing what you might not have seen until it arrived in your emergency room.
Exactly, and not only that, but in the typical progression of things right now, that patient would call 911, be brought by ambulance, with the emergent care to the hospital, be seen by emergency physician, then a CT scan, then the neurologist would evaluate them. And so really we're many steps ahead with the mobile stroke unit in terms of my evaluation of that patient and the decision to treat them with the clot busting medication.
So you're walking in the door already with the diagnosis and the treatment
And
path.
the treatment potentially.
So you mentioned before, Janet, the 2 million brain cells. You have this opportunity. What does that mean in the person's recovery, or in their physical therapy, or in their brain, in their memory recovery, or their function recovery?
So let me step back a few and just say, yes, it's the 2 million brain cells, and this mobile stroke unit is part of a research study across the United States with the other 6 that are deployed. We're number 7 in the United States. And that unit, that timing, what we know from the research so far, the preliminary results from what Dr. Spokoyny just mentioned, we're talking about 11 minutes from the time that unit is dispatched to treatment to the patient, 11 minutes. So if you take those 11 minutes and you get treatment into the patient, and you've got an accurate diagnosis because you have the CT scanner there, the right treatment, the patient's outcomes in terms of the recovery, we can say the probability is better. So let me say that stroke is the fifth cause of death in the United States, but it's the number 1 cause of adult disability. So the things that you were asking about, their aphasia, their inability to speak, paralysis, their inability to walk or use one side of their body or think clearly. We're hoping that getting treatment to them faster, they'll have a faster and better recovery with fewer complications and a better quality of life after through their full rehabilitation. So the speed is important.
So how did Mills-Peninsula become involved in such a groundbreaking project?
So we knew that across the world, so they had been introducing these mobile stroke units, and we saw that this was a really exciting opportunity to really get involved. And so there were conversations with Houston, who is the first one in the U.S. and the leader of the study, about us participating in the project and getting that, just being able to offer that to our patients, the opportunity to participate in the study, yes, but also the opportunity to get this really groundbreaking care in stroke.
So I would like to add that we are so excited about this because every time we can improve care, make it better for the people that we serve in our community, we love our community and they love us. And this is the key thing. This mobile stroke unit is being made possible through the generosity of donors. So the philanthropy portion of this is enormous, and we are eternally grateful to our donors and the community for the type of support that Mills-Peninsula has been receiving over the years so that we can bring this type of service to the people in our community. When you look at a community hospital, some of the most common diagnoses we see are heart disease, heart attacks, and strokes. So to be the 7th city in the United States and the 7th hospital to be offering this level of care to the people in our community makes us feel incredibly good about the service we're providing.
Well, and the impact will be even greater
Right.
to San
Exactly.
Mateo County. So thank you so much for being part of not only groundbreaking care, but bringing it to San Mateo County. As equal to you and your excitement, we are in San Mateo County as residents to know that we have this at our fingertips. So thank you so much for bringing this program to us, and we'll have to have you come back and tell us about all of the successes.
We would love to.
Absolutely. Thank you so much.
Thank you so much for joining us on Penn Voice, and we'll see all of you next time.